Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Today we're still in CPT and we're talking about time. When does time play a role in your E&M coding with CPT? Well, our analogy thus far, we've been baking a cheesecake. And the way we talked about our different levels of history and exam and medical decision making was based on the amount of ingredients, the measurement in our measuring cups for the levels of history and exam were determined by the levels of ingredients in our measuring cup, right? Well, let's look at time. Time when it comes to cooking or preparing this cheesecake that we're making, time is the chocolate. Chocolate, you say, in a cheesecake? Not all cheesecakes have chocolate in them, right? But when you do have a cheesecake that is a chocolate cheesecake, what happens? The chocolate becomes your main ingredient. Well, the same thing with time. When time becomes the main ingredient of an E&M visit, then it's the determining factor. So I guess you say, okay, coach, what do you mean? What I mean is, let's break this thing down. There are three different types of time. There's face-to-face, non-face-to-face, and unit floor time. Face-to-face time is just that, face-to-face. When the physician is face-to-face with his patient and he's rendering care. And usually during that time, he's looking at the patient, he's doing his history, he's doing his exam, and he's trying to come up with his medical decision making on how to better or best treat this patient, right? Well, if during this time, say for example with a 99201 E&M code, new patient, new office, visit code. If you look at the bottom, it says on that code, it says that visit usually takes about 10 minutes to complete. Well, let's say, for example, a patient came in and they have a history of cirrhosis of the liver. And your physician has already done his history. He's done his exam. And while talking with the patient says, well, doc, and she gets into this rant where she says she's having some issues with her husband. And because of that, she started back drinking. Well, alcohol, referring to alcohol. Well, now your physician's thinking about, okay, alcohol, cirrhosis of the liver. He starts doing counseling with his patient about the effects of her drinking, problems she's having with her husband. What was a normal 10-minute office visit now becomes a 25-minute office visit because what was 10 minutes doing history and exam, medical decision making, he now spends 15 additional minutes counseling his patient. Well, that counseling took up 50% or more of that office visit. So now time becomes a determining factor in his office visit. Because remember, that was a 10-minute office visit. But now due to counseling the patient, 15 additional minutes, time becomes the factor. So now time took over, and now you can base your E&M based on time. Okay, I said there's three types, face-to-face, non-face-to-face, and unit floor. Okay, we discussed face-to-face. What is non-face-to-face time? Non-face-to-face time is just that. That's time that your physician is reviewing your lab work that may have come into his office. You're not in the office, but the lab has sent over your lab work. And he's just the doctor's in his office reviewing the lab work, the x-rays. He might be reviewing your chart before he walks in the door to see you in the office. Whatever services he does for you, say for example in his office, ordering prescriptions, planning your care with home health, etc. These services that he does for you that are non-face-to-face, he's not in front of you, but he's working on your situation or your healthcare needs, that's non-face-to-face time. Well, that's not included in where time is the factor. That's included in the relative value weight for your visit. The other bit of time is unit floor time, and that's usually when the patient's in the hospital. When he's at the nursing station and he's reviewing your medical record. Now remember, this time is devoted to you as the patient, but he's not face-to-face with you. He's on the unit or on the floor at the nurse's station reviewing your chart, writing orders, reviewing your lab results, working on continuing your care. Now this time is devoted to you as a patient, but it's not face-to-face with you. Again, this time is in the relative value weight for your DRG that determines your level of E&M for your hospital visit. So again, that's not actually a determining factor in the level of E&M for that visit, because it's in the weight of that particular visit, of that coding for that inpatient visit. But when it's on an outpatient basis or in your physician's office and it consumes the time that you spend with the patient face to face, that's when time becomes a determining factor. So again, the role that time plays in an E&M visit is when 50% or more of the time that the physician spends face to face with the patient becomes the determining factor. That's when time, you'll base your E&M code based on time. So again, it becomes a necessary ingredient or necessary requirement of your E&M visit when it takes up 50% or more of your time, okay? Chocolate becomes a necessary ingredient in your cheesecake when it's a chocolate cheesecake. But if it's not a chocolate cheesecake, you don't need the chocolate. When time does not consume 50% or more of the office visit, then time is not a determining factor in your E&M visit. Okay, so I hope I've explained the role that time plays in an E&M visit. And your time can be face-to-face, non-face-to-face, unit floor, but face-to-face is when the key component of time plays a role in your E&M decision making. Okay guys, that's it for time. In my next video, I will be bringing it all together. History, exam, medical decision making, and if time is a factor, into our final decision making on what level of E&M. I'll even be bringing a pacifier. And you know, a pacifier to a baby soothes, right? We are all babes in coding right now. We're just now learning it. So I'm going to bring you a pacifier to help you bring all this stuff together. But with a pacifier, you then take it away as the baby grows, right? Well, this tool that I'm going to be bringing to you in my next video is a tool just to introduce to you how to use or come up with your E&M code. But then it's something that I'm going to take away, because then you'll begin to put it all together. It'll start to make sense where you won't need the pacifier. So again, guys, thanks. I will see you in the next video.